welcome you to the last day of this webinar. Thank you so much for joining. I thank the people that were able to join yesterday, and if you're here again today, I say thank you. I also thank the planning committees and our speakers for sparing us their time to attend and plan this webinar, and I hope you've learned a lot and are still learning a lot. Today is the last day of this webinar, like I said earlier, and I hope you have a wonderful time. I know I would. Okay, so to start, we shall be introducing our guest speaker, and our guest speaker for today is our very own Dr. Deborah Thomson. She's the founder and president of One Health Lesson, which is an organization that brings internationally acclaimed One Health learning materials from One Health lessons to children and adults all over the world. In addition, she has worked with large animals and small animals as a clinical veterinarian. She has also served as a science policy advisor in the United States and has been a first responder during natural disasters. She's committed to inspiring every student in One Health. And Dr. Deborah Thomson, we're very much happy to have you. And we look forward to a very wonderful presentation. So if you just give me a minute, I would make you co-host so you can start. Thank you.
Well, it's a pleasure to be here while Miriam is working on that process. Just wanted to wish you all a fantastic, happy last day of One Health Awareness Month. Don't know if you already know, but this was a global movement that happened all throughout the month of January. It started last year, January of 2020, and now this is the second annual month event. So I'm thrilled to be joining you. I will be now sharing my screen and we will be getting started. Again, thank you so much for this kind invitation to be here. I'm thrilled to be here today with all of you, especially during the last month of One Health Awareness Month. And today we will be discussing the current global One Health education movement. And thank goodness there's a movement happening in the world. Thank goodness. So let's get started. I usually introduce the concept of One Health with a story, and this is a true story. This is the son of one of my friends. His name is Jack, and Jack in this photo is 7 years old. Jack loves two things. He loves animals and he loves football, like a lot of children. Jack eventually becomes 12 years old. And when he is 12 years old, he's starting to not feel well one day. He tells his mother, and she takes him to one doctor. And that doctor says, Jack's fine. He's just looking for attention. He's 12. But then Jack doesn't feel so well the next day and the next day. And over 2 years, Jack visits over 30 doctors. Jack becomes wheelchair bound. Nobody could figure out why Jack is so sick until Jack finds a One Health team. And what I mean by that is a veterinarian working with a physician. And by taking a thorough medical history and realizing that 1 week before Jack's first symptom, he was playing with a stray kitten who had fleas and he accidentally got scratched. You might have heard of something called cat scratch fever. It's caused by a bacteria. Kittens tend to have more chance of carrying it compared to adult cats. But ultimately, it's not the kitten's fault. It's no cat's fault. It's just how nature goes. And once the physician realized that Jack had this bacteria, then he prescribed the correct antibiotics. And the One Health team saved Jack's life. Not only was he able to walk again, he was able to play football again. And so what is One Health? In my mind, the way I explain it to people who've never heard the concept before is it's really two things. It's a concept and it's an approach. The concept is the interconnection between our health, the environment, animals, and plants, right? The One Health approach is teamwork between people who care for our health and the health of the environment, animals, and plants. Ultimately, you do not need to be a specialist in One Health, as in you don't need to be a specialist in animal health, plant health, environmental health, human health. No, the point of One Health is for all of us to come to the metaphorical table, have a conversation, and bring our strengths, bring our interests, bring our disciplines to that conversation. And then we together as a team can solve some real major health concerns. And when I say health concerns, I mean concerns that affect everything. And that's one of the reasons why I created onehealthlessons.com and the organization known as One Health Lessons. The mission of One Health Lessons is to inspire every child and adult on the planet to value One Health. And this is regardless of a child or a student of any ages, abilities, either mental or physical, and the student's access to internet and electricity, reliable electricity. So the lessons that you can find on onehealthlessons.com can be printed out and used in person where it's appropriate to do so on this planet. And this might be the very first time you're hearing about One Health Lessons, but it might have sounded like it just happened, but it didn't just happen, as a lot of things don't just pop up overnight. There has been a process. And this process happened like this. In 2001, it was when I first really started tutoring adults and having students of my own. I was tutoring math at that time. And then between 2001 and 2008, I found myself teaching in elementary or primary schools. I was teaching music. And then I was also teaching English language learners in secondary schools and also with professionals, with adults. And then in 2008, I was in veterinary school because I'm a veterinarian. And I heard the term One Health. And I thought, wow, my life makes sense now. And why didn't I know about this 20 years before? So since graduating, I have been creating lessons for children and adults about One Health. After I'm done in the hospitals, after I'm done with my 10, 12-hour shifts in the hospitals, I go home and for fun, I create lessons for kids and adults about One Health. And then on my days off, I'd go into schools and be a guest speaker at the science classes and bring these One Health lessons to the students. Then somewhere in 2020, very early 2020, I was having a conversation with somebody and she asked me for my website. At that point, I did not have a website. And I realized, okay, so I've done all of this work. I really should be sharing in a wider sense what I've been doing. And so onehealthlessons.com was born on May 1st of 2020. Now that was about 9 months ago or so. Well, today, fortunately, the 7 different age-appropriate lessons have been translated or are in process of being translated into about 79 languages today. And we have about 700 volunteers around the world working towards either translating these lessons into other languages and or becoming lesson leaders. And we'll be talking about this later on. But first, let's dive into a few slides that are covered in the COVID-19 One Health lesson that you can find at onehealthlessons.com. Now, when it comes to COVID-19, a condition caused by SARS-CoV-2, this terrible type of new novel coronavirus. And I say novel because SARS-CoV-2 has been around in the animal population for, scientists say, millions of years. It wasn't until a mutation happened where it became accessible for this type of virus to jump into humans. We can talk about that later. But ultimately, scientists believe that the original carrier of this virus is bats. And some people say, oh, bats should go away. We should kill all bats. No, that would make our problem so much worse. And this is how I explain this concept to students. And I recommend you all to think about this, process it, and then share it with your communities. Again, this is a slide taken from the COVID-19 lesson. And this is after the students have realized that a beautiful forest that was once taking up the entire screen is now being replaced by people. And you can see that the animals here are in a smaller environment. And that can cause problems because we're stressed, because there's more competition for food, for shelter. We would want to move out, right? And same thing happens with animals. So they have a choice. They can either stay in this stressed environment where you have to have more competition for food and shelter, or you can venture out of the forest and go to the cities. It's probably what I would do if I was a fox or a rat, right? But there are concerns because there's something called zoonotic diseases, which are diseases that spread between different species and certainly include people in that definition of species, right? So let's say, for instance, we take it one step further. Say, for instance, because of climate change or because of just too much competition, a bird leaves the forest. Now, let's exaggerate that a little bit more. Let's say all of the birds leave the forest. Either they go extinct, okay, or they just leave to go to greener pastures, okay, to a nicer forest. And I'm talking about all of the different birds. I'm talking about the parrots. I'm talking about the eagles. I'm talking about the owls and the tiny little birds that eat seeds. Let's talk about all of them. Well, when they leave, there are going to be lots of consequences. And this is why biodiversity is so important and why animal conservation is so important. So when the birds leave, as I said before, some birds are responsible for seed dispersals. Well, when the seed dispersal mechanisms are gone, you're going to have less regrowth of the forest, right? Now, how about, why are there more rodents? It's because the predators that eat the rodents are gone. And so the birds are gone, the mouse population increases, and therefore the fox population increases because foxes eat mice, right? And now look at all of these animals near people. And it's just because of the situation that we've created in the environment. And we can take it one step further with live animal markets, with wet markets, as they're called in some areas of the world. So to take this concept and to apply it in that situation, whenever we have species that really don't belong near each other in a natural world, then we're going to have increased risk of mutations in pathogens, in germs that can be shared between different species. And once people are wandering around these areas where there's like a pot of all of these different germs that can be eventually spread between different animal species, well, of course, we being animals, human beings are animals, technically, we definitely are at risk. And so it's the same thing comparing that to the forest, in that whenever there's inappropriate close proximity of animal species that do not belong near each other, there's increased risk of disease spread between species. Now, fortunately, these lessons are being taught all around the world, including in Nigeria, which is wonderful. But we need more and more people to be spreading this information, because ultimately, if we want to have real changes, we need to change society. And how do we change society and how do we change culture? Well, we start with our communities. And we have to start young. And I know that we have to start young because I've been getting feedback from child students, okay, little kids, that say that after they learn the lesson, then they go home and they teach their parents. They talk about the lessons with their parents. And therefore, the parents are educated. And once parents are educated, then families are educated. And then communities are educated. And then we can start a movement, right? And that, fortunately, is what's happening around the world today. We just need more people, more of you. So keep in mind, bats are really important. And let's dive into an example. Say, if instead of birds going away, let's see what happens with bats. And sometimes bats, a type of species of bats, okay, a type of subset of bats, they're known as keystone species. And we'll go into that next. So if bats go away, there are going to be lots of consequences. And these are the consequences. What happened? Well, with keystone species, a keystone species is a type of species that everything else in the ecosystem really relies on. And the only reason people are here still on the slide is because people are inventive. We try to make the best of a hard situation, but eventually we need to move out too. And so if we don't protect keystone species, if we don't protect biodiversity, we are going to be running into some major problems, as we already have, but will continue to do so. Because when we don't conserve ecosystems and species that are holding the ecosystems all together, well, it's only a matter of time until we have worse and worse problems. So now's the time to talk. Now's the time for action. Now's the time to teach the next generation and communities to really value One Health. Now, most of you probably know the United Nations Sustainable Development Goals. I was originally going to put UN's Sustainable Development Goals, but then it just looked like unsustainable, and I didn't want to do that. So it's the United Nations Sustainable Development Goals, and there are 17 of them. I'm going to highlight now where One Health fits in. As you can see, there are so many. And One Health Lessons focuses on, well, pretty much all of these, but particularly number 17, partnership for the goals. Why? Because partnership equals teamwork equals One Health. Quality education. Quality education, we provide high quality education to people around the world, and particularly reduced inequalities. Because we have online accessible information that can be printed out and used in person. It's also being translated, these lessons are being translated into almost 80 different languages, and we're always looking for more. Because really the most meaningful messages are delivered in your mother tongue. That's the way humans work, right? And it's incredibly important not to use Google Translate and to use the network that's building up around the world, and to have other One Health advocates see the need of bringing this information into their communities, regardless of where they are on this planet, and to then reduce inequalities and provide high quality education to everybody around the world. And so about One Health Lessons and about COVID-19 and the public health response around the world, let's have an honest conversation here, because I have two real legitimate fears when it comes to the public health response on COVID-19. It's really a lack of clear science communication. And that in my book means communication means education, education means communication. It's one and the same. And certainly when it comes to vaccines and when it comes to mutations, the general public they're not expected to really understand the little nitty-gritty scientific terms that go along with these two things, right? But one of my greatest fears is that if we can say convince, I don't like the word convince, if we can educate somebody on what a vaccine is meant for, okay, what a vaccine is meant to do, right? It's meant to strengthen the body to fight an incoming germ, right? That's ultimately what it is. It's like training for a marathon, right? You have to train first in order to win that marathon. So vaccines train your body so that you can fight an upcoming or incoming disease or a germ. But what happens if the person who gets the first shot out of 2 says, oh, my arm is sore, I don't want to get a second shot? Well, are they protected? Is their body strong enough to fight an incoming germ of the same, of what that vaccine was meant for? No. And could the person have a false sense of security? Yeah, absolutely. That is a real concern. When it comes to mutations, a lot of people, the only thing we think of mutations in the general public is like Teenage Mutant Ninja Turtles or cartoon characters or like superheroes when we think of mutations, right? That's what a lot of the students think of, at least that's what they tell me. And so mutation really is change, right? A mutation could be something to strengthen a virus, for instance. It can weaken a virus, or it can just change a virus and it'd be neutral. But it's really important to track the changes. The other thing that's important to have students understand, and this is what's covered in the secondary school and in the adult lesson of COVID-19, is that when it comes to coronavirus, that's a family of viruses. There are at least 4 different types of it. The novel coronavirus is a beta coronavirus, which is strongly associated with bats. And so the shape of this virus, it really comes down to 2 parts. It's the outer shell and the inner core. Okay, and we have different words in fancy science classes for those, but let's just keep it as simple as possible. So there's the outer shell and the inner core. Now, in a normal type of virus, this red virus would be all uniform, inside and out, as what we would expect, a red shell and a red core. But say if the core mutates, and for a coronavirus, those are technically RNA viruses. In RNA viruses, they tend to mutate more frequently compared to DNA viruses. So you can have a normal outside shell, but you have a mutated core. Now, say if we take this example and just make it different colors, just to show that there's variety, this situation would create an as expected virus when it's replicating, when it's making more of itself. And then this would be considered the mutation down here. Okay, so you see how these are different colors. You see how these are different colors. So this is a mutation and this is a mutation. Okay, now let's take it another step. Responsible for having the virus enter into a host cell. And when I say host cell, I mean like a human cell, or in cats, for instance, or in other species, as we're starting to really realize. So if the virus can enter into another cell, it's because of the shell. It's because of this outside lining and the spike proteins that are sticking out. The inside of the virus is responsible for the amount of replication, the amount that the virus itself can divide, can make more of itself, okay? And the thing that's really important to know is that the more something replicates, the higher the chance of a mutation. Something to think about. So let's take this one step further and compare the quote unquote normal type of viruses to the mutated viruses. In this situation, they both can enter into a cell pretty easily, into a host cell pretty easily. However, out of these two versions, these two variants, one of them can replicate a lot more. And why is that a problem? Well, because then that'll increase the risk of further mutations, right? Comparing this again is the quote unquote normal or expected type of virus, and this is a mutation. Comparing these two, this mutated form, this mutated variant is going to have a lot harder time to replicate in a host cell. So as you can see in this example, a mutation can strengthen a virus, a mutation can weaken a virus, or it can just change a virus and not have any type of say in its strength. And these are the types of concepts that students around the world are starting to learn. And keep in mind, mutations can be really, really hard to predict. But right now, around the world, different governments are trying to boost up efforts in what's called genetic sequencing. We're trying to track those mutations so that way we can think in the future of if we need to make adjustments for vaccines. And that's actually what's being done and has been done for many years with the flu vaccine. That's why we have to have a different flu vaccine every single year, because that particular RNA virus, the influenza virus, mutates a ton. Okay, so you understand now what One Health is, right? It's teamwork between people of so many different backgrounds. We come together, we solve complicated problems. You understand what One Health Lessons is. One Health Lessons is a platform, is an organization that brings high quality education to the masses, okay? And now this is your opportunity to not only increase your science communication skills, but also to contribute to your community. And the way to do that is by becoming a certified lesson leader. And we'll go through together what those steps are. The first step, and keep in mind, all of these steps require you to be bilingual. But after the last step, you'll see that we can teach other people who are not English speakers at all. So just have that in mind. Attend a 1-hour online training session. At this orientation session, we teach you how to speak with 6-year-olds and how to speak with 16-year-olds, because that's a big difference. And keep in mind, when it comes to certified lesson leaders, you do not need to be a specialist in One Health. You do not need to be a vet or a vet student. You don't need to have anything to do with the health sciences at all. Or science at all, honestly. All you have to do is be at least 18 years old and to care about One Health. Step number 2 is to watch an online One Health lesson on YouTube. And after seeing that entire lesson, then taking a quiz. Step number 3 is to observe an online lesson. And that will take place in California. So this is all virtual. And you will be observing another person teach these lessons. And you can assist if needed. Step number 4, you yourself teach a lesson to students in California, in the United States, with the help of an observer or assistant if you need it. Now, at this point, you become a certified lesson leader. From there, you can bring the One Health lessons home with you in your own communities, in your own first language. And so number 6 is, once you have taught the lesson at least 5 times in your community, and particularly in your own first language, then you become a One Health Lessons ambassador. And with that title, then you can teach others in your community who speak another language than English how to teach these lessons. And this way we can inspire children. This way we can inspire the teachers who will, of course, just start their teaching careers or continue their teaching careers, but start their, say, relationship with One Health. This is how you can change communities, and this is how you can change societies. So how to become a volunteer lesson leader? You can always email lessonleadersprogram@gmail.com and express your interest. Also, if you go to onehealthlessons.com, there's a how to contribute or how to participate button at the very top. Inside there, there's a link for becoming a lesson leader. And there's a Google form that you will need to fill out. If you fill out that Google form, then we will be in touch with you and we'll go through the process. Right now, we have about 400 people signing up for becoming a certified lesson leader, and that's incredibly exciting. So just to finish up, there are a few last pictures I wanted to show. This is taken from, I believe, a lesson that we taught in 2018. And this is how we explain One Health to students. And you can see that there are various ways students can interpret it, but regardless of what they write, you can see that they really do understand the concept. And so the beautiful thing with these lessons is with the COVID-19 lessons, it teaches, of course, about vaccines and mutations, but also where the virus likely came from, how to protect ourselves today, and what scientists of various backgrounds are doing together, meaning teamwork, to protect families in the future. And this is one of the lessons that was taught in Nigeria in the last 2 months. And the wonderful certified lesson leader was taking it one step further and actually going to the sink in the classroom and having kids actually learn how to properly wash their hands for at least 20 seconds. Now, say if you're too shy and you don't want to get before a class and you don't want to translate a lesson, and granted, this is all volunteer, I get it. For me right now, this is all volunteer. So I totally understand. It's a lot of time, but if you want to make a difference in the world, if you want to contribute to something bigger, consider this. But this is an example of back in 2016, I was asked to present at an Earth Day event in the United States, and everything that you see here is recyclable, and it had been recycled, it had been used before. So I just created a simple demonstration of really what One Health is for kids, and notice how it's quite colorful. Now, when it comes to climate change and when it comes to natural disasters, it's time to think about the big picture, right? In this situation, these two gentlemen are walking in some pretty deep water, right? And can you imagine if there was a farm that's right off of here and the fertilizer and the contamination that could be in this water? And can you imagine if these people had cuts on their legs? That could be a big concern. Another thing, when it comes to changes like this, there's going to be there's going to be more asthma attacks in the communities, of course. And for physicians who are seeing people, during natural disasters, and I had a recent talk with a large group of medical students, and I've been deployed during natural disasters as a veterinarian. But what I was encouraging them, and I'll say it here too, is that when you treat a person, when you treat a patient, when I treat my patients, I see the whole picture. I see not only the patient before me, but I think, what are they living in? What's their environment like? Is there an increased risk of this, that, or the other? And say in this situation, this family clearly lost their home. So if they got hurt, then after they get discharged from the hospital, where are they going? What type of mental health facilities and help is available to them, right? So it's the last day of One Health it's the last day of One Health Awareness Month. But I do encourage you, if you do have a Facebook page, to get this as a banner on your Facebook page for at least a day. And that way it'll start the conversation of One Health. And this is free. You just go on Facebook and you find the way to get banners on and just type in One Health Awareness Month. Lastly, one of my favorite quotes is from a NASA astronaut, and it goes like this: "In the future, I would like to be more of an advocate for animal conservation. Every single part of the earth reacts with every other part. It's one thing." Now, do you think that she was a conservationist before being an astronaut, or an ecologist, or a veterinarian? Why would she care about animal conservation, right? Well, she was actually a mechanical engineer. And probably the reason why she now sees it like that is because she was looking at this. And it really drives home the point that we live on one planet. It's time to talk about One Health. And this thin layer that's right outside that we can't see, but this is what's protecting us all, regardless of where we are on this planet. So the future of One Health is truly global. I welcome any questions, and thank you very much for your attention.
Okay, thank you, Dr. Deborah. It's a very wonderful lesson, and I've learned a lot, and I'm sure everybody has learned a lot as well. So we'll be taking questions for the next 5-10 minutes. If not, I would introduce the second speaker and we can get started. So please type your questions in the chat box and Dr. Deborah would answer them. Thank you.
Thank you very much. It's been a pleasure, and I'll answer questions via chat.
Okay, I don't think they have any questions, but if you don't have any questions now, you can ask later.
One thing I will say is that in the chat, I will post the link for the Google form in case you want to sign up for the Certified Lesson Leaders Program training. And also, I strongly recommend reaching out to Miriam because she is the Nigeria liaison intern with One Health Lessons. So she will be answering any major questions that you have throughout the end of April. And if you are interested in being an intern, everybody else, then in April, I'll be posting on my LinkedIn page. So just go to Deborah Thomson, DVM, so Doctor of Veterinary Medicine. And I will put an announcement there when we open up the application process for interns. Okay, thank you.
Okay, so introducing our second guest speaker in the person of Latifah Abdulkarim. She's a final year veterinary student from the University of Ilorin, Nigeria. She's from Kogi State, Nigeria. Of she's the co-founder and president of University of Ilorin One Health Initiative. That's our One Health Club. She's also ISOHA's continent representative for Africa. And as you can see on the screen, she has done a lot of things and has achieved a lot. And it's very nice to have you, Latifah, to speak to us today. So I will just make you co-host if you give me a few minutes and we can get started. Thank you.
Hello, everyone. Am I audible?
You are?
Yes.
Yes, you're audible, so you have the floor. You can start.
Hello, everyone. Good evening. It's been wonderful here. We've been having really, really nice speakers here, and they've been talking a lot about One Health. So I'll just introduce myself and get to the business of the day. My name is Latifah Abdulkarim. I'm a 600 level veterinary medical student from the University of Ilorin. I am also the ISOHA continent rep for Africa, and the co-founder and presently the president of the University of Ilorin Students One Health Initiative. Okay, please next slide. Thank you. So I won't be talking much about ISOHA because yesterday we had a speaker who talked about it extensively, or ISOHA aims to do. ISOHA's aim is to connect student clubs, collaborate with them, and help them network with people that can help their clubs become better. So what we aim to do at ISOHA is maybe connect them to organizations that can help them, connect them together so that they know each other, so that they can collaborate with each other and partner with each other to have programs, and also to collaborate with them. Next slide, please. So as an ISOHA continent rep, my job is to connect and help these universities with their program, and also for them to create theirs. That's for universities that do not have a One Health Club. So that's the main aim of my talk today. I'm going to be talking about how you can create your own One Health Club, what you have to do before you can have your own One Health Club. Having said this, I need to point that if your university already has a One Health Club, there's no need for you to start another one. You just have to join that One Health Club and help it become better. But if you don't have one, then you can actually get people who are interested or have the same aim as you, and you can all come together and start one. So the ISOHA Continent Rep also serves as a link between ISOHA and the local clubs in the world. We have ISOHA Continent Reps in Africa. Each continent has two. We have in Africa, in Asia, in South and North America, and we have in Europe as well. So we also serve as links between them, and we help to transfer and carry materials, opportunities from ISOHA, communicating it to this continent reps. So we also gather the data of these clubs to ISOHA. We try to update the ISOHA who's in whose map every year. So our data has to be up to date. For example, the president from last year may have changed after a year or two. So we want to have updated information about these clubs, how far they've gone, the challenges they are having, and the likes. Next slide, please. So moving now to Africa, what have we done here? Next slide. In Africa, it may seem like the journey of student One Health clubs has not gone far, but it's actually not so, because we have some regions in Africa that have developed their student One Health networks so strongly that they are well-grounded. For example, in your Central and East Africa, you have the OHCEA, now known as the AfroHome. The OHCEA is the One Health Central and East Africa network, and they are a network of clubs from different universities in Central and East Africa that came together to form one network. They have sponsors from all around the world, and they organize programs in this region for students. The students have a very strong network with the mentors and their patrons, and they work together closely with other organizations internationally. Then presently, they have renamed the organization to AfroHome, the Africa One Health University Network, which I believe is aimed to bring in more people into their coven. They're trying to probably extend towards all of Africa. So you don't just have clubs in Central and East Africa being members of this network. So in West Africa, for example, I have no knowledge presently of any student One Health club in most countries in West Africa aside Nigeria. And with the data that ISOHA has for the who's in who, there are no clubs in West Africa that are not from Nigeria. In Nigeria, we only have two. Next slide, please. Presently, we have only two in Nigeria. This is the logo for OHCA and AfroHome. Next slide. And their partners are, you have the USAID, you have the some student clubs outside Nigeria, outside Africa as well. They also partner with the network in Asia, the South and East Asia One Health Network. I think this is where they got their initiative from to come together and form a partnership, which is really strong. So these partners help them to carry out their activities, help sponsor their projects and the likes. It's a very, very wonderful network, and it would be amazing if we can have something like this extend to all of Africa. Next slide, please. So what does a One Health Club do? You may be wondering, why do you need a One Health Club? What does it do? The One Health Club is an organized group of students in an institution that are interested in promoting One Health. The sole aim of establishing it is to promote One Health. And how do you do that? You organize promotional programs, outreaches, you give out educational materials just for the purpose of educating yourself and the general public about One Health and what it is about. And like I like to put it this way, you educate yourself about One Health to prevent preventable deaths. Because in Africa here, there are some things that shouldn't randomly kill people, or kill people. Things like maybe malaria shouldn't randomly kill people, but kills people in Africa. Things like maybe environmental issues, tuberculosis, those kind of really basic things that you can prevent and protect yourself from, but they have no knowledge about it. So in the long run, it ends up killing people. Hence, you can't prevent preventable deaths. So I feel One Health is basically trying to prevent preventable deaths by just putting in some key what do I say? Some key points in the environment to stop some things from happening in the first place. Next slide. Nigeria. What do we have here? Well, so far in Nigeria, to my knowledge, we have two Students One Health clubs in the universities. We have lots of universities, but we only have two Student One Health clubs. We have the University of Ibadan One Health Club, and we have the University of Ilorin Students One Health Initiative, UNILOSOI, which I happen to be a co-founder of. And I'll be talking about UNILOSOI because it's the one I'm most conversant with. I'll talk about it so you can see what a Student One Health Club is supposed to be like, what you're supposed to aim at. We're not perfect yet. We're actually still trying to gain our grounds as well because, well, we don't have any club to mentor us. We're also trying to find our way. But I think we've done a lot and we can still say yes, we're taking it home. So next slide. In UNILOSOI, or should I say at UNILOSOI, we try to make programs that educate people about One Health and also ourselves. We hold webinars. We hold webinars privately within our own club to educate ourselves about One Health. At a point, we started a podcast as well. That's something you can also do. We hold programs on days like maybe One Health Day, World Rabies Day, World No Tobacco Day, those kind of programs. They are the kind of things you can do when you have a One Health Club to keep it afloat, to keep the So in the picture in the center, we collaborated with Pick That Trash, Kwara, and we went to a market and we cleaned it up. And it was really nice. We sensitized people and we cleaned it up. It was really wonderful. And the first picture at the left was when on World TB about bovine tuberculosis and how the fact that it's actually zoonotic and how they can contact it. We went as far as doing that in the local language for the people there to understand what we were saying and other things like that. Then we, at the other side, the extreme right, you see the posters there are just webinars that we've held, the World AMR Week, the tweet chats. We go on Twitter and it's actually amazing when you do these kind of things and people come around and tell you they have no idea these things happen. I was invited once to a World TB Day program by Yali Kwara, and I was talking about bovine tuberculosis and the fact that they can contact tuberculosis from meat. And someone was asking, really? How is that even possible? I don't believe it. He thought it was just a lie, that it was something that could not happen. These are actually educated people. So you think it's only uneducated people that have no idea about zoonosis, you're mistaken, because a lot of people that are educated and well-grounded have no idea how they can even come in contact with these things. So everyone is actually at risk, and your floor is open to educating everyone. You don't just have to go to a community before you can educate. You can just educate from the comfort of your home. You can just do it by posting something on social media. Your advocacy can be in different ways. Next slide, please. So I'll move now to the agenda formally. The steps to setting up your One Health Club. At ISOHA, like I said, one of the key jobs of a continent rep is to help Student One Health Clubs in universities that do not have in the region which they are continent reps to. So here in Africa, we have a few number of clubs, and that's what we're trying to change this year. So my own sole aim this year is to get more students clubs instituted in Africa, especially regions of Africa that have none at all. And that's why I'm really glad that I'm here. Mariam invited me here to talk today. about this. You go to the official building and you pay an amount of money and they register you as an official club. Without this, you can't hold activities legally in campus, and you cannot also hold programs outside of campus because the university is not going to give you any backing in case anything happens. So you just want to make sure everything is clear and you're holding this club on legal grounds. Then after you've gotten everything right in your university, you tell us at ISOHA, and the way you can tell us is to send an email. Then you send an email so that we can send you the link, or when you get the toolkit, you get the link for the Who's in Who's map so that you can add your club to the Who's in Who map. Then you tell the OHC, that's the One Health Commission. The One Health Commission would also add you to the Who's in Who's map in One Health Google Sheet so that it is internationally known that there is a club like this. For example, when I said there were only 2 clubs in Nigeria, what I mean is that these are the only 2 clubs that ISOHA is aware of. Hence, if there is any other club, we don't know of it and we don't know of its existence. So that's what it means for you to tell ISOHA and to tell OHC. Then you set up your social media and email. You cannot have a program that is not on social media in this era because it just means that you do not exist. So you have to set up a social media platform and an email so that we can reach you and you can reach us officially. Then social media so that you can show the world what you are doing. And who knows, someone may be interested in supporting your group and they would also, people would know about your group and they would want to join. Then you recruit members. The way you want to recruit members depends on you and how it's most suitable for your university. And then you also hold your events, like examples of the events I stated earlier. Please, can we go back to the previous slide? So these are the first things you need to put in place when you want to set up your club. Once you have these 6 steps on ground, the previous slide, please, Mariam. When you have these steps on ground, then you will be able to have your One Health Club already active. Mariam, the previous slide. The previous slide. Thank you. So, no, the next slide.
Is it this?
The next slide. This is it. Thank you. So,
Is this what you want?
Who can help? Yes, thank you. Who can help if I have problems? So if you encounter problems, you can reach out to us at ISOHA. The email was on the next slide. You can reach out to us and we will help you. You could just tell us your problem and what you need and we would help you. And then you need to also have your team. Your team is the executive council that you would have. You'd need a president. If you get the toolkit, you would realize that we have a list of suggested executive members. You should have about 9 or 8 of them. The president, your secretary, you always need a secretary, a treasurer for documenting your money and how you spend it. Your outreach, your vice president of outreach, education, and so it depends on you. You can have a list of your own executive members. It doesn't necessarily mean it has to be the executive members that are stated on the toolkit that you need. Then your constitution. The constitution is just to institute a sort of law and order for your One Health Club, so that even after you, the founding, the pioneer has left that position and you've left the university, you would still have something that guides the laws of your club and everything doesn't just go haywire. We have a list of headings that you should have in your constitution, but you may want to add more things depending on what else you think is important for your own One Health Club in your university, or what you think may arise in your university and how it would be curbed. Then your mission and vision statement. Every club needs a mission and vision statement to make it official. So your mission statement and vision statement, there's an outline in the toolkit that's going to help you draft out the mission and vision statement for your club. So it's going to make it easier for you, and you can easily set up yours. For example, our vision statement at Unilosoy is One Health, One Medicine, One Africa. Then your strategic plan is the plans you have for your club in the first year of its existence, in the next 5 years, in the next 10 years. This does not really have to come immediately, but you need to actually have it on ground so that you have a sustainability plan. It's supposed to be your sort of sustainability plan. So when you leave that position, your club still exists even without you being there. This is in such that it doesn't just die down. You don't just have the club run for a year and boom, it dies. It doesn't exist anymore. So your plan should be solid. There should be a solid plan of succession. There should be a solid plan of appointment and how you can get appointments. There should be a solid plan of programs. I suggest if you want to start a One Health Club, you should have programs that are laid down every year that in such a way that if a new administration comes in and they don't have a plan at all for programs that year, they would have some programs laid out that they must carry out. For example, we have the World One Health Day. We have this One Health Awareness Month. We have World AMR Week. It's a whole week. We have World Rabies Day, World TB Day. We have lots of them. World Rabies Day, like I said. You have lots of them like that, and you can just pick out the ones you want to actually observe every year. So every year, your club has a program on that day or a day close to it to mark it, and it always has to be carried out, no matter what. Also, I would suggest that you may be wondering, how do you get funding for these clubs? Well, that's actually left to you to decide. You may decide to outsource or you may decide to rely on donations, but that is left to you. And you can actually figure that out amongst your team later on when you're instituting your organization. Next slide. The next one as well. Okay. Now, these are ideas of educational materials and opportunities for your club. You can have sort of information sheets. Information sheets are like, they're just like sheets, like maybe PDFs that you send to your club members every once in a while to tell them about some things that are happening in the world of One Health. Like if anyone here subscribes to OHC, One Health Commission newsletter, they send the newsletter most times, and this is like an information sheet telling you everything that is happening in the One Health world that they are aware of at that point in time. Then we have the educational, previous slide please, the educational campaigns. Your educational campaigns can be in different ways. It could be both virtual and physical. Presently, everyone is tuning to virtual because of the COVID-19 problem. So if you're starting now, you may want to keep it virtual, then go physical when it's safer to go out there. Your educational campaigns can involve maybe educational campaigns on about tuberculosis, about coronavirus, COVID-19. There was a slide previously that held a picture in one of those University of Unilosoy's programs that I put there. And it was more like an educational campaign, which held a lot of information that you can tell people about easily. You don't need to really talk about your program much or what you want to educate them about much. You just give it to them and they read it and they understand what you mean. Also, you can have webinars like this where you invite people to talk about One Health and what they can do, people can do to make One Health awareness more. Then you can have infographics. Infographics are basically just pictures that tell a story. For example, you can just have infographics about how to wash your hand properly. So you make the pictures, it has to not be too wordy, so it's not cumbersome to read. Just very little words and more of pictures to show people how to wash their hands properly. educational webinars like this as well. You can input scholarship opportunities for people that want to go ahead and take their careers further in One Health. And then your degree opportunities. Presently in Nigeria, we don't have a One Health degree opportunity or even an MSc opportunity. But if you can get to, if you can leave Nigeria, go abroad. Presently, I know of a university that runs the One Health MSc in London, the London School of Hygiene and Tropical Medicine. They run a degree in One Health in collaboration with the Royal Veterinary College in London. And it's a 1-year program. They also have scholarships sometimes. So if you want to even start a One Health Club, one of your main aims will be to inform your members when the scholarships are out for the LSTMH and when they can actually apply. And you can help them by giving them motivation, inviting people to talk about how to write for scholarships, how to get your CV properly written, your cover letters, etc., for them to be able to land these scholarship opportunities. Then you can also go around doing educational exchange opportunities or programs. At OHCA that I talked about before, I think they run something like this with one of their members, one of their partners at UC Davis, where they do exchange programs. I think they do exchange programs. So the exchange programs is when students from their own university goes over there and they know about what they do, learn about how they run their activities, etc., and come back for a stipulated amount of time though, not for a long time that much. But that is basically what you can do to get people interested in your club or interested in joining. These are the opportunities they stand to get when they join your club or when they join your One Health Club. Next slide. So having said this, in conclusion, anyone can actually start One Health Club. Anyone can start anything. You can decide today that you want to start the biggest platform in the world, but what matters is the sustainability. So if you're interested in starting a One Health Club, you have to first of all think about the sustainability and what you will do to make it sustainable and how long it's going to last in your university. Hence, are people really interested? That's what's going to make it a success. So if you're interested, you can always reach out to me and we can talk about how to. I'm sorry I didn't put my email on this slide, but I'm going to forward it to Mariam and she would forward it to everyone so that you can reach out to us at ISOHA Africa and would help you institute your own One Health Club or send you helps on how you can institute it and what you would need, and also the toolkit that I talked about. Thank you very much for your time. I'll be taking questions now. Okay, I think I have questions on the chat box. Let's see. Okay. Someone said the mission of just. Okay. I'll be waiting for questions now, please.
Hello.
Hello.
Yes,
Good
thank you
evening.
for the nice presentation. This is Shadrach. I'd like to ask you on the issue of having the crab at the university. Then, for example, if I establish the crab at the university, then when I finish my studies, I
Okay.
go back at my home place. How do I maintain or sustain the crab after when I finish the studies?
Okay, that is your sustainability plan. That is why you need a constitution. You would obviously have people that are supporting people that are members of your team and members of the club. So your constitution should have a way of succession. That is the way you're going to appoint new executives. For example, at our own club here in University of Ilorin, what we do is people volunteer, they volunteer, and after they volunteer, we will then assess them, interview them. That's the outgoing nurse coach interviews them, and then we forward to the patron who would also interview them. And if they actually pass the interview, they get appointed. So people that have been working on the club, people that have been attending your programs, when they actually ask to be given these positions, if their portfolio suits it, they get appointed and they get the position. So it keeps running so that when you leave, the constitution is a binding law and they can still be referring to it for this kind of problems, like how to do elections, if you want there to be elections, or if you don't want there to be elections, how to make nominations and appointments and the likes. Does that answer your question?
Okay, thank you. And how do I benefit? For example, if I finish, then how do I benefit from the club?
There are lots of opportunities. Um, if if you if you have a portfolio in One Health already, you already have a lot of knowledge, and applying for One Health scholarships with something like that is going to give you an edge ahead of some people. You'd also get you can easily ask for recommendation letters. You can easily ask for mentorship programs from ISOHA if you're a member of a club, and a lot of other things that you stand to benefit from ISOHA.
Okay, thank you, madam. Basically, here at Nelson Mandela, we have a club, but it is still underground. And I met these people who share you presented in the Afro Horn, and they decided to, they promised to come when they launch the club officially.
That's wonderful.
Yeah, thank you.
Thank you.
Yeah.
Okay, I think somebody else asked that can secondary schools have ISOHA affiliated clubs or is it limited to universities only?
Well, if the university in your area has a One Health Club, I think it will be easy if they are interested in affiliating with secondary schools. For example, in Uniloring, I think if the University of Ilorin Secondary School, that's the staff school, are interested in affiliating with One Health, it will be easy for us to affiliate with them and get them to have a sort of mini One Health Club in their secondary schools under us. But if there's no university close by, I don't know how possible that will be.
Okay, thank
But
you for
if the
that.
university close has it, then you can easily reach out to them to be an affiliate.
Okay. Then somebody else asked that the vision and mission statements is flexible for different chapters, if I get you right, Mrs. Latifah.
Yes, it's flexible. It depends on you. But then there is an outline for what a vision and mission statement should look like. So when you get the toolkit and your mission and vision statement suits the outline for what it should look like, then you can go ahead. It doesn't have to be the same for everyone.
All right, thank you. Does anybody else have any question they would like to be answered? Yes, Oluwatomishi, you can ask your questions.
Thank you very much. Am I audible enough?
Yes, we
Yes.
can hear you.
Okay. Thank you so much, Miss Latifa and Dr. Deborah. I really appreciate. I've understood to an extent very much about One Health. So my question now to Miss Latifa. Um, One Health in your school, that's Uniloring, does it consist of other departments also? Because I know One Health to be multidisciplinary. So does the club in your school involve the medical students and um, the microbiologists and other
Yes.
environmental?
Yes, it does. We actually presently have members in pharmacy, in medicine, in pharmacy, medicine, nursing, microbiology, biochemistry. We used to have members in environmental sciences, but not anymore. And also, we used to also have members in education, health education, and um, public health education, primary health education, and the likes. But presently, our members are just veterinary medicine, microbiology, biochemistry, pharmacy, medicine. But it's open to everyone. Everyone applies, and if the faculty applies, if we don't have a representative for your faculty, we try to make provisions for you. For example, we only have one member from the faculty of Agric in the University of Ilorin. But because of that, we don't have a representative. Because we have representative for each faculty, so that it will be easy for us to reach out to them, since it's a very huge network and the university is really huge, if you get my point.
Okay, thank you very much. And I would like to ask a question actually. Um, do you mind talking about some of the challenges you faced while setting up the One Health Club in our university, and how were you able to overcome these challenges? So these participants can have an idea of what they are likely to face, and it won't be that strange when they come across these challenges. Thank you.
It's already getting dark here. Well, it's actually really challenging. Basically, it's really challenging because one thing about Nigerian students is they want to see, what exactly am I really getting from this? Why should I volunteer my time, my money, when I'm not, you know, getting anything directly from it in the first place? So one of our biggest problems was getting people to participate actively. For example, I said we started a podcast, but because of poor activity, people were not really interested. In fact, to even record an episode was a problem. We had to like stop the podcast for a while. Then we had some programs that we had to stop because of inactive participation. People won't participate, people won't come for meetings, people will just most times frustrate you, but you just have to keep going. And that's why you need to just have your own plan. You need to know the vision for your club, and you have to make sure that your constitution is in such a way that everyone that gets appointed after you has the same vision and mission that you have, so that the next person after you has that vision, the person after that person has the same vision and mission, and it's a chain. Because when you have the person at the top resilient and persistent, they keep bouncing back. So when people don't respond today, next week you come up again and you're like, so we are still here, what's up? What's happening? You get my point. You just keep going and you keep pushing, because the problem is One Health is not well grounded in Nigeria. Unlike some other clubs, people keep asking me, what do I stand to gain from this? But there are lots of other clubs that you don't really see the impact immediately, till maybe in the future when people ask you, oh, yes, I actually volunteered in this. Wow, you did. That means you must know about this, you must know about that. Wow, I'd really like to work with you then. You go for a job interview, you were, wow, that's nice. You volunteered as a One Health club, you had a One Health club, or you were in a One Health club. So you must know about this, you must know about that. Great, then you're the best person for this job. You don't even get asked questions. But that is how I see this. And you should start your career early enough so that you get ahead in a way. So you don't just graduate with your degree and you're out. You need to have something else to show for it. You need to improve in yourself in a way. So resilience, persistence, I think that's just what you need to carry along strongly if you want to start a One Health Club.
Okay, thank you everyone for sparing your weekend to listen to us, to listen to our talk. I hope you've learned a lot about One Health, about how to start a One Health club, about One Health Development Initiative, about the current global One Health education movement, about what else did we learn? How to start a One Health club. You can see that although it's a 2 days event, it was packed and there were lots of things to learn. I know I learned a lot, and I want to believe that everyone else did too. So thank you very much to the speakers for sparing their time to speak to us at this event. We are very grateful. Thank you so much to the planning committees for sparing their time too to also plan this event, because without them it wouldn't have been a success. Thank you, Dr. Deborah, for being a very good mentor and pushing me in the right direction, giving me connections and everything. Thank you, participants, too, for joining us and attending this webinar. Then, as we're drawing it to a conclusion, I would also like to mention some few things that, well, you can take note of and hopefully they'll be beneficial to you. Oops, sorry, it just got dark here. Okay, so you can reach Latifah at isoha.africa@gmail.com. You can also reach me at Miriam Zakaria One Health at gmail.com. I will type it in the chat box. You can reach out to me. I would link you up to anybody that I know that is related to One Health. And lastly, about the One Health Lesson Leaders program, as Dr. Deborah has already spoken earlier, she has spoken in great length about it. I would also like to mention that if you sign up for the Lesson Leaders program and you mention that you're affiliated with ISOHA, you get a certificate with both logos on it. That means you get a certificate with ISOHA's logo on it, and you get a certificate with One Health Lessons logo on it. So I hope after this webinar, a lot of you will be able to join. I also hope after this webinar, a lot of people would think about starting a One Health club in their universities, especially if they don't have any. Because as I was planning this webinar, I realized we just have only two One Health clubs that I'm aware of anyway in Nigeria, which is kind of sad. And I hope more One Health clubs will spring up and will be able to sustain, because it's not just about starting something, it's about being able to maintain it. So starting a One Health club would be difficult, but also maintaining it too is also very important. So I think I should mention that. And I would also like to say that this webinar was also created to create awareness about One Health Awareness Month, and it's ending today, but let's not stop there, because One Health is something that everybody in the whole world needs to know about. So you can't just say, oh, it's only on One Health Day or One Health Month you would want to talk about One Health. You have to be talking about it frequently so everyone can jump on the movement. And I'm sure the more people know about One Health, the better the world would be. So don't stop talking about One Health, and also look for opportunities, volunteer if you can, sign up for programs, attend webinars, just do whatever suits you, but also benefits everyone. So thank you very much for attending, and bye.
Bye,
Thank
Marie.
you.